We're going to start by asking Charlotte, what is female genital schistosomiasis and who does it affect?
Thank you, Reda. So, female genital schistosomiasis is an infectious disease that affects mostly women, and it's one of the most neglected tropical diseases. Over 56 million women and girls in sub-Saharan Africa are affected. And in 2021, with Bridges to Development and the FAST package, we launched 2 workshops in French and in English on female genital schistosomiasis. And this year in May, we had the opportunity with Bridges to Development again and the End Fund to do the workshop in the French language. But as we know that we have a community, an FGS community of over 6,000 primary healthcare professionals, some of whom are part of our immunization network, that have been doing some work to fight against this disease. And that is why we have this session here today.
Wonderful. I also want to introduce Nicole Vecchio from Bridges to Development, our partner for a lot of the work around neglected needs of women's health and specifically female genital schistosomiasis. We'll come back to Nicole as a guide on the side as we hear, and she'll be sharing resources and tools. We're also, and there are also many partners. We had Dirk Engels, who was here this morning for the Francophone sessions. We're looking forward to a great discussion. And as always, Charlotte is going to kick us off. Who shall we hear from first on this topic?
Thank you very much, Reda. So I invited Brigitte Megang. She is French speaking, but she has a very powerful experience to share with us around female genital schistosomiasis. So if you allow, she's going to share her story, and I will be play the role of interpreter, if that is okay.
Right. Yes. We've never done that before, but that's what we're all about. Okay. And Brigitte, okay. Soyez la bienvenue. A warm welcome to you.
Ok, merci Reda. Je reviens encore une fois de plus. Moi, je suis Brigitte Megan, je suis professionnelle de santé et j'exerce dans une structure hospitalière depuis la région du centre au Cameroun.
Okay, so she introduced herself. She's Brigitte Megan. She's a health personnel working in a health facility in the central region of Cameroon.
Voilà, merci. J'ai fait la formation sur la BGF à la Fondation Apprendre à Genève. Et
I participated in the FGS training that was organized by the Geneva Learning Foundation, and
je l'ai fait par curiosité. Et j'y suis restée par conviction.
I participated out of curiosity, but I stayed on in the training because I became convinced.
Voilà, je suis restée par conviction. Pourquoi? Parce que après la formation, j'avais une proche qui présentait des signes dont on nous avait parlé pendant la formation.
So the reason why I stayed on is because during the training, I learned a lot, and I had someone close to me who presented signs and symptoms of what I had heard of during the training.
Cette proche, avec des saignements ininterrompus, elle saignait pendant 2 ans. Elle a saigné pendant 2 ans.
So this person close to me had been bleeding non-stop for 2 years.
Elle avait des saignements par caillot. Elle a commencé par notre structure hospitalière sans suite.
So she had moved from several health facilities. She was bleeding profusely, lumps, and the shift was started by visiting our health facility.
Après la première consultation, on lui a demandé les examens comme l'échographie. Elle a fait aussi le frottif cervical et d'autres examens encore.
When she came to our facility, they asked her to do some tests. They did an echography, an ultrasound, and they also asked for a cervical swab. So she also did that.
Tous ces examens sont sortis négatifs.
And
Et rien
all
ne
the
montre.
results were negative. They couldn't know what was disturbing her.
Pendant ce temps, elle saignait toujours. Le saignement continuait.
And
Elle se
during
vidait
that
de
time,
son sang.
she continued bleeding.
Elle se vidait progressivement de son sang et elle se fatiguait.
And she was getting very tired because of the bleeding.
Elle a parcouru plusieurs médecins sans
She
suite.
visited several medical doctors, even gynecologists, without having a solution.
À la fin,
At the end,
le dernier médecin a juste souhaité qu'on lui fasse l'hystérectomie pour la sauver.
so at the end, the last doctor just said they needed to carry out a hysterectomy in order to save her.
Comme elle avait déjà beaucoup souffert, on attendait qu'on réunisse les fonds pour l'opération.
And since she had suffered a lot from this, so the family was trying to gather the funds to pay for the surgery.
Mais le Seigneur avait permis et avait mis la fondation à Genève sur mon chemin pour cette formation.
But thankfully, I participated in this training on FGS.
Et directement, après cette formation, je l'ai appelé, j'ai dit, bon voilà, peut-être les signes que tu présentes, c'est la bilharziose génitale.
So after the training, I called her and said, these signs that you're presenting, maybe you are suffering from female genital schistosomiasis.
Elle était très contente et elle m'a seulement dit, s'il y a les médicaments, si on peut traiter, sauve-moi.
So when I told her that, she was happy and she said, if there are any drugs, if there's any treatment for this infection, please help me.
Voilà, c'est comme ça que je me suis battue pour trouver le praziquantel.
And that's how I tried my best to get praziquantel for her.
Et par rapport à son poids, elle devait prendre 6 comprimés.
So with regards to her weight, she was supposed to take 6 tablets.
Comme ça faisait beaucoup de comprimés, je lui ai dit de prendre d'abord 3 le matin et 4 heures de temps après, elle reprend encore les 3 autres comprimés.
So she took the tablets, not 6 at once because that was too much. So I told her to take 3 and take another 3-4 hours later.
3 jours après, le saignement a commencé à diminuer.
3 days later, the bleeding began to subside.
Au 5e jour, le saignement s'est arrêté.
On the 5th day, the bleeding completely stopped.
Elle n'était pas sûre. Elle avait peur. Elle se disait que ça devait recommencer.
So she was not very sure. She was scared, thinking that it was going to come back.
Elle ne s'en revenait pas. Elle ne croyait pas que ça pouvait être vrai.
So she was very shocked. That is after 2 years of bleeding in the space of 5 days. So to her, it was unbelievable.
Nous avons patienté. Je lui ai dit de patienter et qu'on essaye d'observer.
So we asked her to be patient. We are going to observe again.
Nous avons fait 8 semaines et je lui ai demandé de prendre encore la 2e dose pour mesure de prudence.
So after 8 weeks without any bleeding, but I still asked her to take a 2nd dose of praziquantel just to be sure.
Parce qu'elle était tellement inquiète, elle avait peur que ça ne revienne.
Because she was very worried, scared that the bleeding was going to come back.
Après les 8 semaines,
so after
et après la 2e dose,
after the 2nd dose,
elle n'a plus jamais eu de saignement.
She has never had that problem of bleeding again.
Les règles sont revenues à la normale. Elle saigne normalement les 3 jours qu'une femme peut saigner et ça s'arrête, ça ne lui crée plus de problème. Elle n'a plus aucun problème de saignement depuis 2 ans qu'elle souffrait de cette bilharziose dans le silence.
So, and even her menstrual cycle returned to normal. So she stopped having this problem of bleeding that she had suffered from for 2 years in silence.
Et après ce cas,
So after
j'ai
this
pris,
case,
oui, je suis allée en parler avec mon chef.
I went to present to talk about it to my supervisor.
Et on a conclu qu'on devait former tout le personnel parce que ce cas était passé d'abord par chez nous.
So I told her about the case and the training that I received on FGS, and she said we have to train all the personnel at the facility because they were the first to receive this case and couldn't handle it.
Voilà, comme personne n'avait pu détecter de quoi elle souffrait, on a dit c'est très nécessaire que tout le monde se fasse former.
So we decided that it was necessary for everyone to be trained since we were not able to diagnose what she was suffering from initially.
Et c'est comme ça que tout le monde s'est allié et on a organisé une formation. Mais avant la formation, on a fait des prétextes.
So that's how everybody joined the training. And before the training started, I administered a pretest.
Et pendant le prétest, on a constaté que sur 80 personnels, 2 seulement avaient déjà entendu parler de la BGS.
And when we evaluated the pretest, we saw that out of 80 people, only 2 had heard about FGS, female genital schistosomiasis.
Donc, c'était vraiment une chose vraiment étrange.
And so to us, it was strange.
C'est comme ça que nous avons fait la formation.
That is how we did the training.
Tous les médecins, les laborantins, les infirmiers, ils étaient même très contents pour suivre cette formation.
The nurses, the laboratory technicians, the medical doctors, they all took part in the training and were very happy.
Après cette formation,
after the training,
tout le monde était déjà capable parce qu'ils ont fait cette formation avec passion.
Everybody was now capable of that because they had participated in the training with passion.
Oui, ils avaient la passion parce qu'ils avaient eu un cas palpable sur la main et chacun était vraiment intéressé et chacun cherchait aussi dans son entourage une personne qui avait ce genre de problème.
So they were passionate because they had seen the case, they knew about the case, and they also went about looking in their entourage to see if there were people that they knew that were having this same challenge, this same problem.
Oui, c'est aussi comme ça que beaucoup de collègues sont revenus vers moi pour faire leur confidence parce qu'elles aussi, elles souffraient aussi de la bilharziose sous silence.
And that's how so many women, they also came. I meet some colleagues, they came and they broke the silence because some of them were suffering the same issue without talking about it.
Beaucoup ont pris aussi ce médicament.
And many, they took praziquantel.
Et elles ont retrouvé aussi leur guérison.
And they were healed. They received their healing.
Notre chef a fait un effort pour mettre le praziquantel gratuitement à la pharmacie.
So our supervisor, the head of our health facility, made efforts to make praziquantel available in our pharmacy.
Pour que chaque malade, ou bien chaque personne qui souffre de cette maladie soit capable de se faire soigner sans difficulté.
So that if anyone that is suffering from this disease, if they visit the health facility, they can be treated without any problems.
C'est devenu une union au centre hospitalier parce que quand il y a même un cas, c'est-à-dire même le médecin doit courir rapidement, venir vers moi et dire, bon voilà, nous avons un cas qui, le malade fait ceci, fait cela, je pense que c'est ce que tu nous as enseigné là, je pense que c'est ça. Et puis ça me fait plaisir vraiment et on s'associe pour sauver des gens.
So it has become a unifying factor in our health facility, because each time there is a case, even the chief medical doctor, she will come to me and say, this looks like what you trained us, and we will join our heads together to take care of the case. And I am very pleased with that.
Ok. Et je pense que vraiment, voilà à peu près les bénéfices de la formation.
So that is, in a few words, what I gained and the benefits of this training. Merci beaucoup, Brigitte. Thank you very much.
Merci beaucoup.
We thought this story was exceptional enough that we would translate it for English speakers. Brigitte shared it this morning with francophones, and we thought it was interesting enough to bring to your attention a concrete case of how around, in which this female genital schistosomiasis stopped being a neglected need of women's health in a particular context and in particular circumstances. I'm pleased to welcome, and apologies, I hadn't seen her when I checked. She wasn't yet in the room and joined right after. Julie Jacobson is a doctor, gynecologist, public health specialist, and longtime advocate and change maker for female genital schistosomiasis. A warm welcome to you, Julie. You just heard this story translated thanks to Charlotte from Brigitte Megang. What does this? Yes, could you introduce yourself and tell us what's on your mind when you hear a story like that, and how exceptional is this story of change in a local health facility for you?
Well, the story is just so compelling, and so I want to thank Belinda for sharing that and being brave enough to share a story like this, because the challenge is the lack of knowledge. And so this is a parasitic infection that comes from contact with fresh water, and the parasite gets into the pelvis and creates this inflammation, which can cause bleeding, as we heard in this story, also vaginal discharge. It can cause an increased risk of the acquiring HIV infection due to the inflammation, and it can cause infertility. So this is a broad range of things that can happen in women and girls just because they had contact with fresh water, swimming, bathing, washing clothes, getting water for the family, for the household. So it's really important to increase the awareness of it and sharing your knowledge, as you just demonstrated in that incredible story, so that others know as well, so women and girls can get this very simple treatment of praziquantel. A single dose of praziquantel can help remove these symptoms and cure the parasitic infection. And so this is exactly what needs to happen, and this is exactly why we want to share this information. It is not a sexually transmitted disease. It is from contact with water. The parasite actually penetrates the skin, gets into the body, and then lives within the pelvis. And that's where they produce these eggs, which go out and cause that inflammation. And so this is a solvable problem, and it's a knowledge gap. And as we hear that people really, once you know, you can take action immediately within your communities. So the story you heard is not an uncommon story, where women go and have hysterectomies or chronically treated for sexually transmitted infections that they do not have, or are accused of being sexually promiscuous when they're not. So it's not an uncommon story, the suffering, but the action that you can take is really what's compelling here. So I'm very excited to hear your stories and to help spread the word about female genital schistosomiasis, so that we can solve this problem and relieve that suffering. So thank you
so much
having me here and being part.
Dr. Julie Jacobson, longtime advocate, and Julie came to us in 2021. Raised this issue of FGS. We called on our immunization community, asking you if this is something that you would be interested in learning about, and you responded massively, both inside and outside of immunization. The best way to access all of the many resources is to go to the Geneva Learning Foundation's website. You find the special event on tackling FGS, and you'll receive a number of resources, including a really important one, frequently asked questions that actually came out of the workshop. But I actually want to tell you a little bit more about that. In May and June 2021, over 300 healthcare professionals in sub-Saharan Africa participated in the Fast Package workshop on female genital schistosomiasis. So this was Bridges to Development, came to us at the Geneva Learning Foundation, invited us to contribute to this effort, and working together for the first time, these health professionals, this is 2021, developed 213 practical, feasible plans for local solutions to tackle FGS in their context. Now, I'm pleased to say for the Francophones, and unfortunately, we'll keep the Anglophones waiting longer today, our community of around FGS has grown to over 6,800 health practitioners. A little around half are from immunization, but the other half are from many other areas. And we are about getting ready to launch for the Francophones, for the second cohort of the Francophones, what we call the Impact Accelerator, which is really a human knowledge network uniting scholar alumni in a shared pledge to turn knowledge into action. To give you a sense of what this pledge that people who participate, who successfully complete the workshop, are invited to make in order to then focus on actually taking action. I'm going to ask Charlotte to read this pledge so you can get a sense of what this is about.
I am committed to work for a world where everyone, everywhere is protected from neglected tropical diseases and especially female genital schistosomiasis. As a scholar, I hereby solemnly pledge to work with others to transform projects led by scholars into action and results that will improve health outcomes, share my success as well as my challenges by reporting on a regular basis on my progress towards implementation, and support fellow scholars in doing the same while upholding the highest standard of integrity and behavior. I make this pledge to contribute to the global goals for the health of women, men, girls, and boys in my country and everywhere.
So when you participate in the FGS workshop, at the end, if you successfully complete the workshop, we invite you to take this pledge and add not only a commitment that you have as a health worker, but also a moral commitment to actually getting to the results, getting to impact and making that difference. When we asked participants in previous impact accelerators, this is what you told us were the most valuable aspects: collaboration with country colleagues, learning from other countries, focus on action in the field rather than theory and planning, regular reporting to stay on track and focused on impact, and knowing that scholars share that same pledge that each and every person has made. Now, this is about mobilization, momentum. It's also about healthy competition, networking, overcoming difficulties, and leveraging resources. Now, we only have 7 minutes left in the session, but I am going to turn to Charlotte. I know that there are many other FGS workshop alumni from 2021 for the Anglophones who are, I believe, in the room with us and would love to hear from some of, at least a few of them. I see Rukaya Mumuni from Ghana has her microphone already ready to go. Rukaya, tell us, you are an immunization worker. You work for the Ghana Health Service. How did you end up getting involved with female genital schistosomiasis? And do introduce yourself.
Okay, Reda, thank you so much for this opportunity. Hello, everyone. My name is Rukaya Mumuni from Ghana. I work with Ghana Health Service and I work at the sub-national level. Basically, I do immunization. So my work, about almost 99% of my work is vaccination. But I am part of the Geneva Learning Foundation community. So when I got the opportunity, when I had the invitation to join, I never even heard about female genital schistosomiasis for FGS. So I was curious because when I read about the statistics, I was so alarmed because it affects a lot of women and most health workers. Me myself, for the first time I hearing it, I never even came across it during my school nursing training and during my further studies in nursing. I have never come across FGS. So I took the opportunity and I took part of the workshop. And I had an action plan to engage community, because I do a lot of community engagement. I educate communities on vaccination and other health issues of nutrition. So it was an opportunity to me to educate my communities about FGS, and also to increase the awareness in the communities, and also to educate other health workers, because if myself I'm not aware, meaning a lot of us are not aware. So it was part of the action of my action plan to raise awareness on FGS. And along the line, we had the opportunity to be trained as first subject matter expert. Actually, it was a very great opportunity for most of us who took part in the FGS training on the online workshop. And we had the opportunity to meet Dr. Julie in Ghana. That took us through more comprehensive training on FGS and how to integrate FGS activities in the healthcare delivery. So it actually motivated me. It actually gave me that encouragement to go ahead and then make sure FGS activities become known in the hospital. So I took it up, and luckily for us, I met some of my colleagues at the training. We were about 3 of us that were coming from the same facility, that were part of the in-person training in Accra. So we teamed up and we took FGS back to the district and trained most of our staffs on FGS. I work with a lot of community health nurses in the community, so I trained them. Then I made sure in one of our meetings as preventive health nurses, I raised the awareness. I created awareness on it, and most of them were not aware about FGS. So it actually increased awareness among health staff within the district. And after the training, I realized one of the nurses came up to me, Rukaya, I have been having this issue for a long time. Most of the symptoms, the signs that you have mentioned, most of the signs that you mentioned about, or you trained us on FGS, I have been experiencing it. She had this repeated vaginal infections for over years that is unresponsive to antibiotics. Then she also have issues with conceiving. She has been trying to conceive for a long time and she's not able to conceive. So she told me, and she also mentioned that she had contacts. During her childhood, when she was growing up, she was living in areas where she had contact with freshwater bodies. So it was a clear sign. It was a clear indication that she might be suffering from FGS. We quickly gave her the treatment, and she took the first dose of praziquantel. And after some months, about like 2 months time, she came back and she told me that the signs, all the vaginal discharges that she was experiencing, and it was not responding to antibiotics, has disappeared all of a sudden. And that was one of the greatest stories. So all of us who were involved in the FGS training were so happy that we were able to identify a case even amongst health staff that we were able to treat. So I think FGS, what we are trying to do now is to integrate it with cervical cancer screening. You know, FGS can complicate cervical cancer. So we have screening, we do screening at the hospital. So I have sensitized myself and the doctor that took part in the training. We have sensitized the staff that is engaged in carrying out the cervical cancer screening to be able to detect if somebody is unresponsive or is negative for cervical cancer screening, but have lesions. Then we should suspect and then maybe treat for FGS. And that is what we are doing. We are actually making sure that every health staff is aware, so that we'll be able to increase them suspicion of FGS and we'll be able to treat it. And I was so happy when I met Dr. Julie at the Women Deliver Conference. We teamed up to raise awareness and to make sure that policymakers, especially when it comes to cervical cancer treatment, we integrate FGS into cervical cancer treatment and then screening efforts, so that we'll be able to make impact, to be able to screen more people, to be able to get more people treated with FGS. And so far, this has been my story about FGS.
All right.
And
it sounds like an amazing story that's only just beginning. I do want to turn to at least one more person, if Charlotte will allow me to go over time. We've both been facilitating since around 7:30 this morning. So Rebecca Bello shared an experience. For some reason, it's kept some of the drafts we have are confidential, but would hear. I hope, Rebecca, I know you've been with us all day as well. Rebecca, you shared from Kuche area in Abuja. Yes, a story. You said FGS awareness is work I always do in rural communities, and I also encourage women to go for urinary tests at the hospital. We already have a case of a rural community in Kuche area of Abuja that needs attention. Can we finish with this story, your experience of tell us what happened, what you did, and how it turned out?
Okay, thank you very much. My name is Rebecca Bello, once again from University of Abuja, Department of Community Medicine. I am a medical laboratory technologist. So one of our medical students, a resident doctor to be precise, is running his master's in public health in our department. And I discussed, because I was introduced to FGS from the Geneva Learning Foundation, because myself, I never knew that women can be infected with schistosomiasis, they can have that disease. So until when I learned from Geneva Learning Foundation, I was now sharing with some of the resident doctors, and two of them picked interest and decided to carry out research on that particular disease. So we decided to visit this particular community in Kuje. We decided to go there because we know that they usually have problem of water and other things, and they are male. They have this particular disease. There was a particular research from that community that shows that the men have that schistosomiasis disease. So we decided to go there and check the female. And after we did all the community entry, we visited the village head and the rest. They granted us access to the women. We now mobilized them and started educating them on this FGS. And some of them, being like me, I'm the one that usually speak more of the local language, the Hausa language. So when we were talking to them, and the girls decided to have a session with them. So they open up to us about their problem, if they are urinating, how they usually see blood. They thought maybe it's part of a woman to see blood in the urine because they menstruate. Unfortunately, they didn't know that they were having that infection. So we decided to collect their urine samples and stool. So I came back to the lab. We were able to collect 382 samples of urine and stool. Lo and behold, the urine was something else. We were seeing the ovaries of schistosoma hematobium in their urine, the female. As I was carrying out the work, I was like, I've never seen. Because if not that I went there myself, I would deny that it's not from a female. But being that I was there, I saw it myself. The specimen carried blood. It was something else. But at the end of the day, we forwarded the reports to the committee, that there is a particular committee that belongs at the teaching hospital. They are part of the Nigerian Society of Female Genital Schistosomiasis, Society of Nigeria, something of that nature. So I've not joined the Nigerian faction anyway, but I'm hoping to join them in their next meeting. So we forwarded the report to them, and they are working on how we are going to go into that community for intervention.
Thank you very much indeed, Rebecca Bello.
I think that's where
That's a remarkable story. One of many and a growing number through this collaboration with Bridges to Development came, and actually we already knew each other, but decided to work with the Geneva Learning Foundation to see if we could scale a program. Initially was supposed to be focused on Madagascar and Ghana, and we said, well, could we include participants from other countries? It will not cost us any more to be more inclusive and to open up access. And you've heard some of the results today from some of the countries that were not in the original plan. I'd like to turn to Julie Jacobson. This is, Julie, something that you've dedicated very much of your energy, your professional career. Would love to hear your parting thoughts. What's next for FGS, and what are you taking away? For you, it's the morning after this session. Would love to hear some final reflections before we close.
I think for me, the power is the power of the people that are on this call, and you all that are taking action. The compelling stories and sharing this knowledge, and the fact that you are all seeing this. The challenge has been that this doesn't get reported, and so it doesn't officially exist. And here we hear about all the silent suffering that's gone on. So for me, you're inspiring me. I'm here at an infectious disease conference in Boston, and then going to Chicago for another tropical medicine disease meeting, and I'm going to share this information with the people that I meet. And I appreciate all of you doing the same and reaching these women and girls with this inexpensive single-dose treatment that can reduce a lot of suffering. And so I'm inspired by you and hope to continue to do this in any way that I can help serve this population, and hope to be a part of the solution as you all are. Thank you.
Wonderful. Thank you very much, Julie Jacobson.